We have this problem here which we have to find out the solution for, and this problem is coming from one of the questions which was being asked in one of those released files. So we will find out the proper solution, what kind of options are there, and what actually they want to know, or what they want us to learn from that question actually, and what would be the possible answer to that question. So basically that question is about the long span fixed partial denture and the optimization of marginal fit with cast and solder technique. So let's start with that. The problem says the marginal fit of the retainers in a 5-unit fixed partial denture is optimized by casting the framework in sections and then soldered using an index made on the master cast. Well, second option is sections and then soldered using an index made intraoral. One piece and then sectioned and soldered using an index made on the master cast. The fourth option is one piece and then sectioned and soldered using an index made intraorally. And fifth one is one piece and not sectioned or soldered. Generally, we do this. But when they ask us this question about this word optimization, it was making us a little bit suspicious. Generally, it is not a very common practice that we really section or we cast in pieces and then we do the soldering. Most of the time it is not required unless some special situation arises, or if it is really a long span fixed partial denture. Well, when we looked into the literature, we found certain very interesting articles and something in the textbooks. The precise fit of fixed multi-unit dental prosthesis is considered very important in clinical prosthodontics. Poor marginal fit of cast multi-unit restorations may hasten the onset of failure due to abutment caries. To assure the fit of metal frameworks on abutments, a trial, the spelling of trial is not correct, it's trial insertion, is generally performed in a clinic. If any discrepancy is detected, sectioning and joining of metal frameworks are required. This is the last slide. This is the question in your released files. And this is what we found in the literature while we were going through the different articles and the textbooks. Well, according to the textbook Contemporary Fixed Prosthodontics, we found these few points. Controversy exists as the relative accuracy of partial FPDs that are cast in one piece, pre-ceramic soldered or post-ceramic soldered. Individual laboratory technicians often obtain consistently better results with one particular technique, but scientific evidence is conflicting in evaluating clinical work to determine whether cast or soldered connectors provide better results. The determining factor should be the fit of the individual retainers. This should be optimized through the investing and casting process to minimize the risks of incomplete seating or excessive luting agent space. In some situations, it may be impossible to cast a long span fixed partial denture with ideal retainer dimensions and ideal inter-abutment dimensions. The challenge lies in obtaining enough inter-abutment expansion without making the retainers too loose. In such circumstances, a soldered connector may provide better accuracy. Then there was one article we found which was published in 2011, Fixed Partial Dentures, Options for the Dentist and the Patient, by Bruce W. Small. Similar to any other restoration with porcelain such as PFM bridges, there always remains a risk of porcelain fracture. This can occur as a result of laboratory error, restoration design, adjustment of the porcelain with a handpiece at try-in or insertion, which can cause micro fractures, and the patient's occlusion and or bruxing. To help prevent these problems, the metal framework of the bridge must have a passive fit without any binding or movement of the abutment teeth. Larger bridge frameworks should be assembled in the mouth by connecting copings after a passive fit is achieved and then soldered in the laboratory. As the length of the single piece FPD casting increases, so does its inaccuracy. So according to one of the studies, they reported, Savium et al. Reported that bridges with a pier abutment, such as a 5-unit with a abutment in the middle, is not a favorable situation. Now over here we can see the 5-unit bridge. Actually in question they didn't mention about the angulation, they didn't mention anything about the pier abutment, but if we look at it, it is a 5-unit bridge. 1, 2, 3, 4, 5, where we have one pier abutment. Situation could be in a different scenario as well. Well, over here let's see that they are talking about this scenario. Or if we look at the lower bridge, again the similar situation, we have 3 abutments, 1 pier abutment replacing 2 missing teeth, so it is basically 5-unit bridge. So either this situation or this situation where we have a pier abutment, we could have different types of scenarios, especially if it's a long-standing edentulous space. The distal abutment at times tilts slightly, and all of us are familiar with the solution that if such a situation occurs, we can give a non-rigid connector in that condition. The precision type of precision attachment type of this connector can always be a solution in such a situation. Well, if there is a problem, what we can do? We can section the bridge. If the proximal parts after sectioning they are in close proximity, it's very good. We have already casted it in one piece, then we sectioned it, we placed it in patient's mouth, we checked they are in close proximity, we made the index, we sent it to laboratory. Over there they will solder it, the trial will be taken, and finally the porcelain will be applied. But in most of the times what happens, when we solder, the gap is way too large for soldering to be done. This is a big problem which we face when we have to do the sectioning after casting in one piece. So what could be the solution? After doing the wax up, using a ribbon saw, we section the pieces in the bridge in 2 pieces, and then we cast it in 2 pieces. The sides should be made flat after sectioning. This is important because it will provide us a space for proper soldering. Then it is cast in 2 pieces. It is now ready for the trial in patient's mouth. When the trial will be done, then we will make the index intraoral. How we do the intraoral index? We have placed it in patient's mouth in this manner, and now the gap is there. We will use a self-curing acrylic for making the index over here. Like there are different types, a dozen of different types of procedures which you can use. I have taken this particular step from the fixed prosthodontics book by Schillingberg. So step by step he has explained how to make this index inside the oral cavity. You can use a self-curing acrylic for that purpose, and then using a tongue blade and the plaster you can make the index. It will create an index for the bridge which is now inserted in the mouth, and we have connected it using the self-curing acrylic. The self-curing acrylic and the index over here, it is in patient's mouth. It is transferred to the laboratory so that there won't be any change in the position now. That's why we need this index. And this is the ideal situation in patient. We want our bridge, because both the parts, they are in passive fit. So it is using this index, it is invested. A special investment is used for this purpose. The index will be removed. Once the index is removed, we have gained the access to that gap, and using the torch, a special solder is used for soldering in this area. Keep in mind, these base metal alloys, it is very difficult to solder them. Whenever you are planning such a situation, your technical support should be very, very strong, and they should be well versed in these type of jobs. After that, you can see how the connector is soldered, and now the bridge is ready to be inserted in patient's mouth. So this question, the marginal fit of the retainers in a 5-unit fixed partial denture, is optimized by casting the framework in sections and then soldered using an index made intra-orally. Everybody is good about this? Yes or no? So over here we are done with this question, and soon we will be discussing other questions in this manner as well.